What an exciting day. Look at these trainees, look at these graduates, look at the excitement of the faculty, of the leadership of community health and mental health that's here today to celebrate. Look at these posters. I mean, in 2 years, we've gone from imagining something to really execution. When Robert says execution, it meant if we didn't do it, the other execution was another interpretation. And looking at these spectacular people who will enter into wonderful community health centers to be able to partner to truly transform American healthcare at a moment of tremendous stress and transformation is, for me, inspiring. Gives me more than hope. It gives me real optimism at a time of significant challenge. You know, the Kraft Center is an embodiment of the mission of the Partners Healthcare System. We're all about young people and about trying to figure out how to do the best for our communities, for our patients, and learning every day from young people who make us better, who teach us to use science to be able to inform our care, and to inform that care with a great deal of science. And at the end of the day, to invest in our communities. This hospital was founded for the purpose of allowing every person to have access to great care, regardless of their ability to pay. Similarly, the Lying-In Hospital for Women and the Peter Bent Brigham, the forebearers of the Brigham and Women's Hospital, were founded in precisely the same way. That is what our system is about. We created recently, in a partnership with Neighborhood Health Plan, the Partnership for Community Health, in which we're investing in community health centers throughout the state over the course of time, to create further tools in addition to this kind of spectacular human capital to be able to transform and give them the tools to be even stronger in their ability to provide the greatest possible care and to provide really a North Star for the transformation of American healthcare in regard to its access. But one of the things that we thought about related to this program was making certain that we would have a pipeline of the very best people to be able to fill our community health centers with what they needed the most, great physicians and great nurses. We've had a tool that we've been working on for a couple of 100 years. We call it academic health centers. Academic medical centers and health centers are a magnet, at least we've had the great fortune here in Boston of being so, of wonderful young people who make us better each and every day. And then we needed to have a program led by a Pied Piper I knew that could essentially be a Pied Piper and be able to attract young people in a way that they would stay connected, understand where they started, and continue to move forward. And that's why it's appropriate that our keynote speaker for this moment is the greatest such Pied Piper, who embodies all that there is around social justice and healthcare, who has taught us more than we could possibly know about bringing exceptional talent into the toughest places in the world for people without food security or housing security, people off the grid and without water, people sitting in the shadow of disaster and of extreme poverty, and understanding that for them there is hope. And in using a set of tools, in teaching the people who live within an environment how they can be healers and to be a pathway to great healing and to transform health within an environment and extend life expectancy within almost a blink of an eye. I assure you that this is the same kind of work that we need to do within our own communities, and it's inspired by the great work that our next speaker that he has been doing really for the past quarter century throughout the world. Paul Farmer, our rock star today, is the Collocatronis University professor and chair of the Department of Global Health and Social Medicine at Harvard Medical School. He's chief of the Division of Global Health Equity at Brigham and Women's Hospital. He was one of the founders and founding director of the magnificent Partners in Health, probably the most important global health agency in the world. And he's the United States Special Advisor to the Secretary General on Community-Based Medicines and Lessons from Haiti. He is somebody who is tremendously steadfast in his commitment to doing great good and will not give up until that great good is done. He and his colleagues in the US and Haiti, Peru, Russia, Lesotho, Malawi, Mexico are doing great good to try to use communities, community health workers, spectacular physicians and nurses to change the course of outcome, to extend life expectancy, and to bring true social justice to each of those environments. He's also a brilliant writer. All that time on the plane gives you time to do something. So just remember, don't watch the movies. He has written substantially about issues of power and social justice extensively. He's an anthropologist and a physician, and he embodies for us really what is the marriage of social justice, healthcare, and academic brilliance. My dear friend, Paul Farmer.